Hello guys, and welcome to the next episode of Let's Play Project Hospital. Let's jump right into it. I cannot speak anymore. And the title was Busy Day, as you remember. It is a very busy day. Our goal is the same as yesterday, basically trying to go through the day in a way that utilizing all the hospitalization and everything, make sure that everybody is treated and everybody is taken care of. Nobody's sent back home. That's the main goal. And we already have hospitalization in 3 different departments other than the ER. We already have hospitalization in general surgery. Oh, look at that. These are my trauma centers. We have 2 guys here. Both of them are stabilized at least. But both of them still have a long way to go before we know what's really wrong with them. So we're gonna figure that out. Okay, let's get rid of everything here. And let's, as always, let's go through what we have in terms of people waiting for me, first of all. And second of all, in people that are in the hospital bed. So Jennifer Cole, we scheduled for her some FAST and ECG. The FAST is to figure out what's wrong with her if this serologic sampling doesn't help. The ECG is actually partly for that, but partly to make sure that she's not going to collapse on us for some reason. Joseph Foster, we just checked. He had a septic shock, so we had to put him into CT hospitalization. And we already scheduled a triage of a lot of different exams, physical, CRP, ear, and oral cavity inspection. He's going through all that. He's going to be busy for a while. Now let's see. There is Jane Thomas. He's waiting for the player. Actually, I'm going to get rid of these. I just want to keep those that are waiting for me. That's a lot of people here still. It's only 11:27, so that's fine, but we have a lot of people in ER, so we have to really try to get rid of them as soon as possible. Nobody's in the ICU. General hospital, going to chair. Nobody's waiting for me. Nobody's waiting for me in internal. One person is already treated, so we definitely, if we find somebody from internal, we have to send over. Orthopedia is supposed to have 35% more than normal, but normal is not too many. We have 4 people there right now, so we have to be careful with that. We have 3 people in the hospital actually, in the cardiology department that we just established yesterday. I mean, game time yesterday, I think. Fully being treated. He's gonna get some NSAIDs. Yeah, let's give him some NSAIDs. Paul Harris, he is fully treated. Judy Robinson, also fully treated, so no problem. They're gonna... Actually, I believe these 2 are supposed to leave the hospital within today. They should be all good. Look at that. Everything is black. They've been there for a while, so that should be okay. Neurology, we don't have anybody in the hospital, but there is this Thomas Lopez. Has some high. We already put him actually into hospitalization. And hopefully he is going to be there. But right now he's checked. They are doing a thorax percussion, and then probably he's gonna go to the hospital, I guess. And Fraser Harris, that's just a normal patient, and we already know what's wrong with him, so it's gonna be easy. And let's say finally traumatology. Oh, that's a lot of people in traumatology, more than normally. 2 of them are treated already. That's good. That's interesting. Normally there are not so many people here. Nobody. Okay, so there was only 1 person waiting for us. Let's quickly go through as well. Do we have any critical rooms? Onco rooms critical. Okay. Okay. I think we don't have enough doctors right now. Let me see how many people are actually in the onco room. Oh, only two. Okay. I'm gonna get one more doctor. Actually, only one. Oh, no wonder. No wonder. Let's get somebody here as well. Even though I know it extends my... Okay, what can you do for us? Let's see. Let's remove the hidden stuff. This one looks good. Advanced diagnosis, general medicine, acute medicine. Yeah, he's very good. A bit expensive. He's a bit on the expensive side. That's a good question. Should I get somebody who is better? Like this? Oh, she's 62. This one's... Oh, no, definitely this one. Okay, you have... Oh, acute medicine 8%. That's a little bit on the low side. But then again, if I am the one who is actually controlling it, we could go for like a middle, like this one. 47 years old. 32%, 25 is still very low, obviously. Like this guy I wouldn't want because he has 30 feet. I'm sorry. That's always bringing down the prestige, which by the way today is 98%. That's really not bad. Okay, you know what? We just really need some help here. So I'm thinking between this or this. Definitely not this one. She's really good, but she's too expensive. Although, who knows? 62. Yeah, I mean, this is, but acuteness 8% only. That's really just too low a little bit. I don't know. But as I said, if I tell him everything what he has to do... Yeah, let's get her and let's try to improve her. Okay, so now we have on-call rooms medium. That's good. This one... Oh, nobody's critical. One is high. Okay, good. These people are bored out of their minds. Okay, this... No critical. That's good. Definitely nobody's critical. Nobody's critical. Yeah, that's good, actually. Not that bad. On-call rooms as well. Alright, we're good. Alright. So, let's just get back to it. You are... Fraser Harris is waiting for the prayer. Oh, I didn't notice that. I was just like, okay, I clicked on him, but actually he was the one waiting for the player as well. I totally missed that. Alright, so let's see. Joseph Fraser Harris. You basically... Where are you? Let's take a look at you. Oh, you're just walking around? Okay. We already know what your problem is, but... Oh, you're going to do an ECG. No. Why are you waiting for us? You already scheduled an ECG. I think we just scheduled him for the ECG, so that's why he's saying that's waiting for us. But this one is really waiting for us. So, Neurology Department. How many people do you have, guys? In neurology? 2. Okay. You gonna go over to the Neurology Department, please? Okay. Is there anybody in the Neurology Department I could use? Nancy Cole, yeah. Nancy Cole, you're gonna be busy because you are my doctor. You go over there, you do a physical and neurological and an ophthalmoscopy. Okay, we take it from there. All right, and let me take a look. If I go here and I say start. Okay, now he's examined. You see, he was already put in that exam. Okay, examined. Okay, procedure uncovered a new symptom of a favorite patient, radius fracture. Okay, so let's just go. We already know exactly what your problem is. James Gonzalez is not our doctor. You know what? Orthopedia is gonna be overwhelmed, but right now we have a lot of people here as well. Like I have to kind of decide. Actually, it's not overwhelmed. Kind of alright, only 4 people. So I'm gonna send this guy over to orthopedia. And all I ask them is just please fix her. I mean, this is a woman, sorry. Alright. Barbara Lopez, what's wrong with you? Ankle fracture. Yeah. Sad day for you. We haven't done a physical, which actually could find a lot about you, and there is nothing else we can do. So let's just do a physical. Daniel Walker. Look at that. This is orthopedia problem as well, and also a leg cast. I'm thinking, should I just handle some of them myself here? But you see, it needs some more. Physical, physical, physical. It's only physical. Because I have so many patients here that I'm not sure I can handle all of them here. So you also go over to orthopedia. Yeah, go over to orthopedia and do a physical. Oh, you did a physical already. Then just fix it. Same thing. All right. And Christopher Brown. Oh, look at that. It's all orthopedia. Yeah, they said that 30%, renovation of a nearby clinic causes 35% more patients to come to orthopedia. So, okay, now we don't know which one is this. Normally, I believe we can do a physical and differential. Rachel Hall, can you do a differential? No. So how do you figure it out? You have to do an X-ray. Okay. Or an EMG. You might have a fever, actually. So let's do a physical. And let's do a temperature. Let's see what turns out. And then either we send you to another doctor who can actually check your, do a differential, or send you to either an EMG or a X-ray. Oh, let's go to the quicker one because this way it's going too slow. Broken ribs, again, orthopedia. Look at that. Lisa Hall, is Lisa Hall our doctor? No. And we did the chest auscultation already. Should I just fix him here? Compression reps. You know what? I'm gonna do this one myself. I mean, Lisa Hall is gonna do it. Because we have so many people going onto orthopedia, it's gonna be too bad. Okay, at least this one is not over orthopedia. Casey Rodriguez is having a muscle joint pain and night sweats, and we already did 2 pages now, it's actually 1 page of exams, nothing came out. CRP we did. Excuse me. Muscle and joint pain, night sweats. Speech listening we have done, and nothing came out. Okay. Temperature we have checked. CRP we have checked. CBC, a CT, microbial. The interview would show that. MRI. Should we just do an evaluation maybe? Evaluation is very overlooked. It's actually very powerful. I'm going to try to do an evaluation first. Without anything else. Yeah. Did we do an abdominal? Let's do an abdominal. Hold on. Let's do a couple of small things first. Let's do an abdominal palpation and neck palpation. We did it already, right? Yeah, we did that. Auscultation, we did. Okay, so let's do an abdominal palpation first. Let's see if it makes any difference and then get back to you. Jordan Clark, look at that. We actually know what your problem is. Hypertensive renal disease. Okay. Oh, yeah. You are the one. Are you the one who we know that we have to have a surgery with? And we just know. Okay. So we already know that you have to do the surgery. That's fine. So why don't we actually put you into a hospital bed? And once you're there, you should do a few things. Thorax percussion. Actually, let's start with the more important one, blood pressure. I mean, let's do all of them. Urine analysis. Yeah. You know, once they are in the hospital, we can actually give them a lot of different things easily. So urine analysis, blood pressure, no need. Thorax percussion. We're already getting analgesics, but yeah, I mean, why not? That's a very simple one. A blood test. Would a blood test give us anything else? Not really. So that's all what you're gonna do. At least he's in the right department, so go on. And she's going into bed. That's good. Frank Johnson. Okay, you have a pork tapeworm. Alright. We're not gonna do a blood test. We're just simply gonna treat you. So, who should treat him? I think let's have one of our doctors treat him because let's go one of the less... Okay, let's Elizabeth White. Yeah, let's Elizabeth White treat you. Okay? So we're gonna have a pork tapeworm and we're gonna give you antihelmintics. Okay, whatever it is. You have abdominal pain, so we're gonna give you some pain medicine. We're not gonna give you anything else. That's all. Please take care of him. Thank you. Elizabeth, I owe you something. Alright. Casey Rodriguez. Abdominal palpation we checked. Okay. It didn't show anything. Not surprisingly. So now we've done the small part. So actually, let's do something more. What did I saw first? Let's do a microbial, MRI. That's all a bit too much. Let's go for an ECG. That's why that place is so busy. I think I really will need to build some more cardiography or I think it's called cardiography rooms. I have to have more of that because, oh, wait a minute. Yeah, he hasn't done ECG, okay. I mean, I'm doing so much ECG, it's unbelievable. Okay, let's do an ECG. Let's do actually a microbial testing as well. Let's start it as early as possible. Should we do also serologic testing? The serologic testing, I think it's easy, not a big deal. Just have to find it. Serologic sampling, there you go. I think that's enough. It's gonna keep you busy for a while, and we're gonna have the results before the evening, so we can treat you today. That's fine. Barbara Lopez. Okay, ankle fracture. Look at that. We actually figured that out. That's good. No, we just gave him the physical. That's all. So everything else is done. Mark Johnson, please just treat him because you're not my doctor, so I don't even care how you do it. Just do it, please. Let's see. Do we need... He doesn't need a leg orthosis because he gets a leg cast. Interesting, you see? This one would get a leg orthosis, but since he gets a leg cast, he doesn't need that. Okay. Analgesics he's getting. Let's give him some recommendations. Otherwise, you're good to go. All right. Elizabeth Green, what's wrong with you? Oh, you can actually go home. Everything is good with you. These are all low and suppressed. You see, pulmonary embolism, that's such a big deal. And you're already getting everything, and you can go home. Brilliant. There you go, one more person treated. Finally, we are 19. It was 18 for such a long time. It was really annoying, you know. I felt like, come on. All right, you have... It's definitely a neurology issue, so please go over to the neurology department. Thank you so much. And while you're there, do a neurology testing. And jonioscopy? No, it's microbial. Do you have a jonioscopy? A physical? Yeah, that's a physical. All right. For now, that's it. And let's see, actually, should we... Excuse me. Nancy Cole is busy as hell, but he is our doctor there, so I'm gonna send him over. Send him over to her. Christopher Hall, beef tapeworm, iron deficiency, anemia, or Ebola? Definitely not Ebola because we don't have the department for that. Again, cheating, I know. But what about the other two? Beef tapeworm, iron deficiency. At least both of them are belonging here, so we don't have to worry about that. I definitely do a physical, let's do an abdominal. And let's also do a chest auscultation. All right. Oh, look at that. We did figure out what exactly wrong with you, neck palpation. So we already did oral oral, did we do? No, but we're already getting the NSAID, so no need for that. As far as I'm concerned, at least. Temperature, we have checked. Physical, we did. Interview. Neck palpation, we did. Didn't show anything. Oral cavity again, so we don't need to do anything else. Sarah Martin. Again, not my doctor, so you just being treated. Thank you. Does he need a steroid cream? He has some rash, but not so bad, so no need. Go to. Okay, so he either have a cubital tunnel syndrome or a golfer elbow. Rachel Hall cannot do uh, what is it? She cannot do differential, so we're gonna send over to Mark Johnson and ask him to do a differential. Hopefully that's gonna help. Mark Hill, go to, okay, he's got influenza B, good, so it worked out the way I wanted. Originally it was could be both of them. Normally what I used to do, if I see influenza A and B, I always send them to a serologic testing, but actually, if you do some nasal, these kind of things and do a differential, they can figure it out themselves. So Jessica Johnson, thank you so much, please treat him. There you go. We have quite a few people now treated. That's good. How many people do we have treated here? Let's see. Well, some of them we sent away, so not all of them are treated, but there is 1 treated, 2 treated, 3 treated. Okay, 3 people are already treated here. That's good. Let's keep it up, guys. Okay, we did a nasal cavity on you. You're done. Nasal cavity. Okay, we know that you have a common cold. Awesome. Now, what else we have to know? Chest auscultation we did. Temperature, we haven't checked your temperature. Are you serious? Okay, we definitely have to do that. Sorry about that. Again, this one is also chest auscultation. This one is also, it's physical. So we did everything. We just double check on your temperature. And if everything is okay, you are out of the hospital in a couple minutes. Judy Green, what do you have? Okay, Traumatology Department. He's got some kind of burn. What we definitely start right away is a physical, without anything. Let's do a speech listening, just in case. Okay. Nothing else for now, because we just want to first determine what the hell is wrong with you, and normally, maybe an evaluation. No, that should be enough. Frank Clark, you are itching. Okay, like scratch it, like so. Okay, again, he went through a triage in the reception and he went through an interview and he still doesn't know if he's itching on his leg or on his arm or ears. Are you serious? Anyway, let's do physical. Let's do actually a quick... Oh, we cannot do a Skinnerology test here because we are in internal medicine. Oh, okay. So after a physical, what else can we do like very quickly? Let's do a chest auscultation because various things can actually give you some coughing and stuff. Actually right now that's all. Hopefully we're gonna figure out at least where you're itching, right? At least that would be logical as far as I'm concerned. Okay, common cold, we know everything about you, so yes, look at that, she does have fever. Alright, Elizabeth White is our doctor, so we're gonna give her everything ourselves. We're gonna ask her to rest. She does get a fever, so get her some fever medicine. She has a... Okay, it's low, 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 low. Shadi got low, 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 low. Okay, got it. Everything is low, so that's all you got. Sorry, I'm not gonna give you anything else. Just go. Now somebody here is being taken to some exam. Jennifer Cole is going for her ECG. All right, fine. The good thing with this is that when they are in the hospital, they are not gonna wait around. You don't see a waiting line. There is one person here waiting for something. What is it? He's waiting for the X-ray, okay, because somebody in there is doing the X-ray, okay. But it's, you know, it used to be sometimes ever a lot of people waiting. There is no such thing here. One guy here. Oh, he has to do all different kind of things. Sorry. That's all right. All right, so let's go back to Charles Thomas, actually. Oh, that's the guy. I was like, this doesn't look like a Charles Thomas, but got it. We just see him from the back. Uh, ooh. Okay, that doesn't look good. What do you have? Chest pain, fever, and night sweats. Mm-hmm. Okay, so definitely we do a physical. We're gonna check how much your fever is actually. Let's do a chest auscultation. And I'm thinking of a thorax. Would a thorax mean anything? Maybe not. Let's start with this and let's see if it clears up some of the things. Look at that. She is going into the hospital, so actually going back actually. Interesting. Okay, so she got the X-ray and we already know that it's a simple fracture, which is an orthopedia thing normally. Again, how many people in orthopedia now? Are you guys clearing up or what's going on? One is treated, 1, 2, 3 is waiting, one is going to doctor. Oh no. The orthopedia is way overwhelmed right now. We might need to set up one more orthopedia office actually, because I think we only have 2. Where is orthopedia? Orthopedia, this one, yeah. You see, we only have 2 offices, and I have a feeling we are a bit overwhelmed there. How much is to build up an orthopedia office? And these ones are the 1, 2, 3, 4, 5, 6 times 6, right? Is it? 1, 2, 3, 4, 5, 6. Yeah. Okay, it would be 5,000. Kind of hate that. I don't really want to spend that money, but I think we might need it. You know? Yeah, I think let's get one more orthopedia here. I mean, we are getting ready for more, altogether more patients anyway. Our goal is to like fill this place up 100% anyway. Problem is, if I do that, I also have to put on those things, a little bit more money as well. That's okay, I'm gonna do it. Simply because I really want to make sure that it works perfectly. I don't want to leave anybody behind. Now the only thing is I actually have to, that's annoying, I actually have to do something like this and make sure that things are painted in the right way. Now if I click on here, we do need, hey, hold on, here. Everything is there already. Oh no, I have to click here. So I'm gonna need a key machine here. Right there. And a TV. Right there. Alright. So we spent all the money, I know. But before anything, obviously we have to hire a doctor. who are we hiring here? Somebody who can help. Actually, you know what? Who do we have right now? Only have two people here. One, he has advanced. She has 5% surgery. This guy has 26% surgery. She's really good. Unfortunately, old as hell. 570. That's a lot of money, though. And she's 73 years old. But I have a feeling that we're gonna have to have a surgery for orthopedics soon. And if such, maybe we should hire her. She's not. I don't want to spend 1,000 NTs just to figure out what of these, because neither of them is good, to be honest. Okay? So yeah, let's just go for it. Okay? Now the orthopedic department should be all better. Right, so now we're gonna send you over to orthopedic department because we have, and let's send you over to this brand new doctor here, Margaret Harris. Let's see how she does. Okay. All right. Oh, hold on. Obviously, you already figured out everything, so just please treat her. I mean, I don't even need to see what she's doing with her. Pulmonary embolism again. Look at that. So many people. That's just crazy, you know. That's not supposed to be like that. Now, I believe we don't have a lot of patients in cardiology as, look at that, only one patient. 4 people are already in the hospital, in the bed. Okay, so this one we can send him over easily to the cardiology department. Let's see, is there anybody cardiology that's there? Danielle Jones, yes. So please, Danielle Jones, you're gonna take care of her. And what are you gonna do? Once she's there, let's do a physical, a chest auscultation, a temperature. Now, thorax percussion. Yeah, let's do that as well. I mean, right now we're gonna he has to go and do a ton of different things right now. She will have to do a blood pressure. I mean, sorry. We don't need an angiography. That's good. Speech listening. Let's do that. And you have to do an ECG. You might have to wait for that. There are a lot of people doing ECG. Look at that. 1, 2, 3, 4, 5, 6, 7. We already know what his problem is, so, and it's still only 12 o'clock, so he can finish all of this and get the treatment with no problem, I believe. Although he's probably gonna feel overwhelmed with that, but that's okay. Rattlesnake bite. Okay, at least we know what's going on. We're gonna do, it's not right now, not life-threatening apparently, so let's do a physical. Let's do a chest auscultation. And I think we're done. Yep, we're done. All right, go. Christopher Hall. Beef tapeworm. Okay, so abdominal palpation did the trick, I guess. There's nothing we can do with you anymore. So let's just give you some antihelminthics. We're gonna give you some analgesics, pain medicine. Nope, 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 nothing else. Thank you so much. Okay, Judy Green apparently has some big problem. Radiation dermatitis and she's got necrosis, which needs the debridement. Okay. What else? Physical, we done already. Done already. Done already. No need for the evaluation. Pigmentation change. It would need steroid creams anyway. So you know what? We already done everything. So after you done that, Jane Green is not our doctor. So after you done that, just simply treat her. Thank you so much. As you can see, her, the red little exclamation mark already gone. So he's already doing okay. And I'm sure she's gonna take care of her very well. I hope that she's gonna give her all the other things as well. But doesn't really matter. I believe we're gonna be fine. Atopic dermatitis. Okay. So physical and chest actually figured out what's wrong with you, and we already have all the possible things that can be there. So all you have to do is just treat him. Thank you so much. Antihistamines, do we need? No, that's fine. Kate Lewis have finished was antipyretics, so he got the fever medicine, and he's pretty much done everything. Everything is low, 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 low. Whatever is wrong is treated. So Elizabeth White, you've done it again, and that was our number 20 customer. Good. Finally. Thomas Lopez. Okay, so you did get the anti-arithmetics, so you are basically nicely stabilized right now. We know that you have meningitis and you're already in the hospital. You're eating. Okay. Now, what else do we have to figure out about you? Physical, temperature, interview. See, we don't need that. Eardrops. Okay, can we do an odometry? I don't think we can do that. Yeah, we cannot do that. So even though it's there, I cannot do anything about it. So let's just, you are already in the hospital. I'm sorry, disturbing your eating, but you're gonna just simply get the IV antibiotics, okay? You're gonna get some pain medicine. And you know what? You don't need it, but you are in a hospital, so you're gonna get this one as well. And that should take care of you. Okay, ophthalmoscopy. Wait, I didn't actually like get rid of the guy, right? No, okay. Jane Thomas, ophthalmoscopy is done, and it did come up with some, I don't know, come up with what? One of these was supposed to be showing it. Ophthalmoscopy came up with something, but it doesn't say with what. Blurred vision? No. Red eye? No. Eye pain? No. That's weird. So what did you come up with? Anyway, do we have some? We are in the, what is it? Neurology Department. Basic visual test, we already did. Actually, probably that's what ophthalmoscopy figured out without our help. So let's see. Tonometry, ophthalmoscopy, we did, but it didn't. Loss of vision, maybe that's the blurred vision. I don't know. It's kind of weird. Okay, let's do a gonioscopy. The reason is that she's in the office. So if you do a gonioscopy, you can actually do it in the office. You don't have to leave. So that can help you. We already did a neurological testing, yeah, and it showed nothing. So a goniooscopy should be enough for now. Let's see if it actually, maybe it actually solves the whole problem. If not, we're gonna dig further, okay? Okay, so you got treated for your beef tapeworm. Everything is done. Elizabeth Hernandez, actually our doctor. Everything is treated. Let's see. Yeah, we don't need any of these. All right, so you just go home, sir. Okay, and that was 21. Look at that. We are on a roll. Okay, so you already did a chest auscultation, and look at that. It actually shows that you do have some breathing problems. Good call. Physical also showed a couple of new things. Stomach, nausea. Other than that, nothing else we can do. So basically, just give him the antivenom. Barbara Williams is not our doctor, so I don't even go into the details. You just do it. Rest. Whatever. All right. Dana Harris is our doctor. I haven't seen her for a while. She's not treating a lot of patients today. She's being a bit lazy, to be honest. You have bronchopneumonia or endocarditis. Okay, so one is basically a lung issue, the other one is a heart issue. Okay, what would actually determine what's really wrong with you? An MRI, an ECG, echo. Okay, let's do an MRI. I haven't done MRI for a while. So the MRI machine, the MRI technician is probably just standing by the whole day, so I don't want her or him to be too bored. But at the same time, while we're there, why don't we do some speech listening? Just have a chat. I think it's good. Okay. Let's go to Nancy Lewis. Ankle fracture. Oh, okay, that's also orthopedia problem. Now, we have a ton of people in orthopedia, so you should be able to handle it better. We haven't done any physical, right? And that's pretty much all you need. Would it actually help you anything? It would give you EMS, but we cannot give you EMS for whatever reason. ICEREP, pain medicine. I think you are getting pain medicine for sure. I'm not even sure we have to do that. Okay, let's take a look quickly again how many people we have. Orthopedia, we have 1, 2, 3, 4, 5, 6, 7. 6 actually, because one is already being treated. But look at that, we already have 1, 2, 3, 4, 5 already know the diagnosis, which is, I think, very good. And how about here? It's actually not that many. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2. Jessica Johnson was the last one. 3, 4, 5, 6, 7. There are 2 Jessica. Oh, not Jessica Johnson was the last idiot. Hold on. Jessica Davis was the last one. So that was 12, 13, 14, 15, 16. So it's 2 per doctor. It's pretty much the same, I don't think it's a big issue here. I still want to do it like basically properly, okay? So I'm going to send it over to the orthopedia and ask them to do a physical at all. I don't think they need a physical. It would give him an ICEREP, that's all, and it's a low thing, so just treat him. Just treat him. Thank you. $675. I probably could have keep him here and make my goal a bit earlier, but whatever. Broken ribs or chest contusion. Okay, Elizabeth White, you have 1%. That's not enough. I have to give it to Elizabeth Hernandez, who's gonna do a physical and a differential. There you go. Go. Jordan Allen, pork tapeworm. Okay, we know what your problem is. It's actually an emergency problem. Sarah is not our doctor, though. Should I send her over to somebody? No, I'm just gonna keep it as it is. So, you do a physical, for sure. Abdominal palpation, yes. That's it. That's pretty much it. Simple. Elbow bursitis and golfer elbow. Actually, let's do a physical. Do we need a differential? Mark Johnson, can you do? Yeah, you can do a differential. So do a differential. That should probably give a 100% correct answer. Okay, Thomas Lopez. So, and now what? He is hospitalized. He's still getting a ton of medicine, but I think he's already he got everything he needs. Although no, he still has some hidden problems. Other than odometry, we cannot do anything. Okay, we've done everything, I believe. So we're just gonna let him just cure. Okay, so you just stay in the hospital, sir. Enjoy your stay. It's a normal, regular hospitalization, so we don't have to downgrade you to somewhere else. That's fine. Richard Scott is just tired. I mean, look at his face. He does look tired. Like, okay. That's tough. Being tired. That means 16. That means 96 different possible sicknesses. Let's start with the physical. Speech listening. Chest auscultation. Neurological testing. I think that's more than you need. Okay, we already know exactly what's wrong with you. We have all the different symptoms, and this is our doctor. Awesome. So what's left is just simply treat you, give you some NSAIDs, nothing for this, nothing for this, nothing for this, and give you some pain medicine. That's it. Thank you. Once he's treated, they're gonna let us know, and he's gonna go. David Hall, microwave burn. Okay, you will definitely have to go to the traumatology, where unfortunately we don't have anybody waiting for you. So just whomever in the traumatology. It's medium, nothing really serious. So let's do a physical. Because we might have to do some debridement and everything. Blood test, no need. Yeah, that's pretty much it, my friend. Go there and let's see if everything is okay. It's already 12:37 in the afternoon. Let's see how many people we have. Still have 36 people here. If you calculate that 36 plus 34, that's actually 70. Plus 8, that's 78, but it's still gonna be a couple more because we did have like a few people starting with in the hospital. We have 8 people in the hospital. Actually, a couple of them should already go home. I don't know why they are still there, but hopefully they are getting out of here soon. All right, Joseph Foster. What do you have? He is in the hospital and he pretty much got everything finished. Oral cavity didn't show anything. Okay. What kind of things we could do? We did an ear exam, didn't show anything. Speech listening. We cannot do that here. Why? Why not? All right. Let's see. I mean, let's just get rid of some of the things that could kill him. Okay. Or should we do some? No, let's do some of the simple things, like a chest auscultation. And that basically looking for some things that could, like, really differentiate from other stuff, right? While it's still simple. Abdominal palpation. Fever, septic shock. But if he has a septic shock, oh no, that doesn't mean that. Can he have an abdominal palpation? Would it help him? Is there anything actually needs that? Possibly, right? Yeah, here you go, you see? Let's do an abdominal palpation. Let's do a neck palpation. We haven't done a blood pressure. Let's do these right now. I mean, he is hospitalized. He has all the time in the world, so let's just do it. Okay, you have pork tapeworm as well. You have a lot of people with pork tapeworm. I don't know why. We have done a physical and abdominal. Apparently, it didn't show anything, but it was good enough. Or maybe it was original like that. We knew that he had that. So nothing wrong with you. All you have to do is just get, let me see, Sarah Martin. He is not our doctor. So we just leave it up to the doctor to finish you up. There you go. We don't need the rest. Okay. Another one, pork tapeworm. Look at that. Everybody's getting pork tapeworm. This is our patients, however. So let's make sure that she got a nice physical and an abdominal palpation. And that's it. No need for blood. That's all. Jane Thomas, Nancy Cole, thank you so much. You treated her fully. She is ready to go home. Okay, and we're up to 22. Richard Scott. That's a lot of possibilities still. Physical, speech, chest, and neurological. Okay, that's not gonna cut it. We have to do something closer. Let's do a blood pressure, because that could really show that, you know. Let's do a CRP. Let's see if you have any kind of inflammation or whatever going on. Let's do a thorax actually fatigue. Let's do a basic visual test that could help, right? Is there anything that basic visual test? I'm just checking. I don't see any, to be honest. Look at that. I mean, there are so many possible sicknesses. They do have ophthalmoscopy instead. You know what? Let's not do a basic visual test. Let's do an ophthalmoscopy. It's basically like looking at your retina, I believe, very closely and check out if you have any problem. We haven't checked if you have fever. Oh, that's not good. Hold on. Temperature. Yeah, for sure. And that's it for now. Okay, so we did a differential and it did show that it's elbow bursitis. So Mark Johnson did the job what we asked him to do. Really appreciate it. So all you have to do is treat him now, Mark Johnson, and you can do it all yourself because you are not my doctor. So bye-bye, Thomas. Okay, hold on. He is a bit... Are you a bit too low, low, low? You get that? No, that's okay. All right, one more here. HDD with heart failure. Okay, that's a problem. That's kind of a problem, and it's definitely a cardiology issue. So, what is... And we cannot even give you diuretics, so you have to go over to the cardiology, and they have to give you diuretics, and then I would say let's do some physical. That would give you diet modification. That's already good enough. Stomatics, whatever. So let's do a physical on you. But first get the diuretics. Hopefully you can go all the way there. Alright. Carol Martin. Uh-oh. Okay. So what do you have? Abdominal pain, diarrhea, and we already did a ton of different things with you and we couldn't figure you out. Alright, here's the things, guys. I have more or less this much time today, so we're gonna continue this tomorrow. As you can see, we are doing pretty well. Right now, we already have 37 people fully done. We went up to 22 in the treated patients, that are patients. I selected, I think, a pretty wrong bunch of doctors because these people seem to be lazy. They don't treat enough people. Our prestige up to 99%. Orthopedia is, for whatever reason, not so happy. I don't know why. Money-wise, we are still kind of lagging behind, but if we finish the day, we should have some extra money. And I hopefully finally can give back a little bit of this. Otherwise, we're gonna be in trouble. Big trouble. Okay? Alright, so thank you so much for coming. If you like what you see, please hit the like button and hit the subscribe button if you haven't yet. And then come back next time. Thank you so much and bye-bye.